Good morning, church. All right. Once again, my name is Adewale Babatunde. I'm a family physician and I head the medical league of the church. Today is World Changers Sunday, and we have been our leaders in the League of Professionals have allowed that we continue giving health talks, and we're also grateful for this privilege given to us by the leadership of the church in being concerned about the overall well-being of people in the church. So we started in the first service talking about hypertension, which is known to be a silent killer. One of the things we emphasized was that a diagnosis of hypertension is made when in the office you have at least 2 readings that's greater than 140 or over 90. You can have either one of them. That would still make a diagnosis of hypertension. And many people actually are walking around with hypertension, are not aware, and also are not taking care of it. And so we are concerned about some of the complications that could happen. You can skip to the go to the next slides, please. We're concerned about some of the complications that could happen on the kidneys, on the heart, causing things like stroke, causing things like erectile dysfunctions and all that, because these are all organs that are supplied with blood vessels that can be easily damaged by persistently high blood pressure. Okay, so I'm going to let's move to the slides after complications. Let's go to complications. Next. Yeah, okay, so let's go to the next slide. We've already talked about some of the complications, and we said that one of the reasons it's important to pay attention to hypertension is because it does have complications. Many times we need to understand that the problem is not just the high blood pressure. The problem is the problem that the high blood pressure is causing, if that makes sense. And it does it so silently that you may not know that anything is going on until these complications have actually taken place. And we said some of it includes things like kidney failure, heart failure, stroke, and amongst others. So in this session, we would like to take time to say that, okay, so what are some of the things we can do to help to control hypertension or prevent hypertension? Because I hope we know, for example, that if my father or my mother has hypertension, my risk of having hypertension has heightened than the general populace. Apart from the fact that our general lifestyle these days has totally changed, that makes us more susceptible to these non-communicable diseases. One is to reduce your salt intake. Reduce salt intake. Sodium is a major culprit in hypertension. And let me say this, that many times when I talk to patients and we say that, okay, you need to cut down on your salt, people say, yes, actually I don't even use salt anymore. What I do now is I've upped my Maggi. Okay, so what you've actually done is that you are still consuming a lot of sodium. Okay, so we can cut down on our sodium intake and our taste buds will adjust. And that's actually the reality. We need to take more fruits and vegetables. One of the observations we have that generally it's not really in our habit to take fruits and vegetables. I ask people, maybe I take it once a week and all of that, but it will be nice if you can think that with every meal, let there be a fruit, let there be a vegetable. That's the simplest way I can say it. So there is something called the plate method, and we'll be talking about diets in some other times, but there's something called a plate method where by the time you divide your plate, at least half of it is already taken up by fruits and vegetables, okay? So being physically active, trying to get as much physical activity as we can, avoiding tobacco, limit the intake of saturated fats, many of which comes from processed meats, red meats, and all that, okay? So there's a whole concept called dietary approach to stop hypertension, and these are some of the major things there. Next slide, please. So hypertension needs to be managed. And one of the ways we could manage, are listed above. And one of the things I will like to emphasize is regularly checking your blood pressure, okay? Not making an assumption that, okay, it was high last week, but no, now I'm fine and all of that. It's regularly checking your blood pressure. And I emphasize to people, I understand the problem of a pill burden. That, okay, I'm going to swallow a pill every day. I mean, if that is recommended, the first stage is always to change your lifestyle. But if you do need to take pills to prevent complications, to prevent you from having a stroke, to prevent your kidneys from failing, it is cheaper, it is easier, and we would recommend that is done, okay? And of course, managing other medical complications. Diabetes, usually many people would develop diabetes, high blood cholesterol, and all of that. And of course, one of the reasons why you need to be regular with your healthcare provider is to be able to not just control your blood pressure, but look out for complications that could be setting in, many of which are very silent. Next slide, please. Okay, next slide. So I just brought up a slide to just show these are some of the common ideas that people have about hypertension. Okay, somebody would say, I actually don't have hypertension, but sometimes they say my blood pressure is high. Okay, also somebody would say that, oh, my blood pressure is high when I'm stressed. Now, it's understandable that if you are stressed, you might have a transient rise in your blood pressure, especially the upper value. But let's be truthful to ourselves. If you are having onto 2 or 3 occasions and that your blood pressure is elevated, you have hypertension. And it's important for us to identify this so that we can be able to deal with it. Some people would say, oh, it's when I had an accident that I developed high blood pressure. Well, it's possible that it is when you had an accident is when you checked your blood pressure. It's most likely that it has been there all along. Okay, I know how I feel when my blood pressure is high. High blood pressure is many times asymptomatic. And so that is the reason why we must check our blood pressures from time to time. Okay, all right, so I'll just skip through a few. Okay, I only had blood pressure when I was pregnant. Okay, now this is important. It's possible to have what you call pregnancy-induced hypertension. But please note that even if you had that and your blood pressure became normal, you are at risk of developing chronic hypertension later. And so you need to be more aware, okay? So these are some of the, so let's just go to next slides. Okay, so the World Hypertension Day was in May last year, and this is the message: measure your blood pressure. And that's the message. When last did you check your blood pressure? Accurately control it and live longer. Next slide. Okay, no symptoms does not mean normal blood pressure. Next slide. Thank you very much.